Okay, the next several videos are going to cover the basics of imaging modalities used in clinical practice. So we're going to start with X-rays, which are the oldest of the imaging modalities, having been in use for over 120 years. And these are sometimes also called plain X-rays, plain films, or simply radiographs. So X-ray examinations are by far the most dominant form of imaging. In fact, it's approximated that 75% of all imaging studies are X-rays. So that leads to the question of what are X-rays? And as you may remember from your time in college, they are a type of ionizing radiation. So you can see here that we have the visible spectrum of light, and then as soon as you move past ultraviolet light, that's where now you move into the X-ray realm. So X-rays are considered ionizing radiation. So you might remember that that means that X-rays are capable of breaking molecular bonds like those found in DNA. So that means that X-rays are damaging to the human body. So as a result, X-ray imaging is not a benign process. It affects human tissues and can cause DNA damage as well as other tissue damage, which we always have to weigh with the benefits of doing this imaging. So when X-rays pass through the human body, so you can see here is an X-ray generator, so you can see the X-ray beams that are coming out from that X-ray generator that are going to pass through the human body. Some of them are going to scatter, but the majority of them are going to pass through the human body and eventually reach the image receptor or the detector in this case. And so as the X-rays pass through the human body, they're attenuated or blocked to varying degrees based on the density of the structures that they contact when passing through the body. So the resultant image, which you can see an example of down here, one of the shoulder, it represents a 2D projection of the attenuating properties of the tissue encountered along the path of the detected X-rays. So this means that you'll be viewing structures stacked on top of one another, or in other words, the shadow of a three-dimensional structure. So you have to keep that in mind when you're reading these images, that anatomic features might be limited by this fact that there's overlapping structures. And again, you can appreciate that here in the shoulder where you can't really well appreciate the acromion process because of the fact that it's overlying other parts of the scapula, which you can see right here. Whereas if you look at the clavicle up here, or even the humerus down here, you'll notice that, of course, there's nothing on the other side of those bones, and so as a result, you get a relatively clear image of those structures. But again, if you're looking, say, in the chest, where the beam is passing through a bunch of different structures, the heart and the lungs, the chest wall, the spine, etc., all of those three-dimensional images or structures are going to be compressed onto a 2D image where you're going to have to be looking through various structures in order to appreciate the anatomy that's located there. And so the way that X-rays are stored in modern days is through a system that's known as PACS, which we'll be talking about here in just a moment. So first I'm going to move on to the next image here. So with modern X-ray imaging equipment, which you can see an example of over here. So you can see this is the plate detector, and then this is the X-ray beam, and then here's kind of a caricature of how this works. So with this equipment, basically what happens is we're going to send a beam of X-rays through the patient to the detector on the other side of the patient. So again, you can see these beams passing through the patient and eventually contacting the detector. The detector then sends a digital image to a computer system. And so these digital images are stored and viewed on that PACS system. And PACS stands for Picture Archiving and Communication System. So PACS, you'll hear that term a lot if you're working in and around radiology in the clinic. So because the goal of imaging is to visualize certain structures, positioning the patient is extremely important. So the way that we position the patient is going to dictate what structures we can see and how we'll be able to see them. So oftentimes multiple views, like say frontal and lateral, are going to be required with X-ray so that you're able to appreciate the relationships of these three-dimensional structures to each other. So you can see over here on the left, this is an AP view, so anterior posterior, where the beam is passing through the anterior surface of the person and emerging to the posterior surface. So that's a frontal view. And then over here you can see a lateral view where it's passing through from the patient's right to the patient's left in this case. So again, oftentimes we need those multiple views to appreciate different structures. To further enhance contrast resolution between different structures, we can also administer oral, intravenous, or even intra-arterial contrast media in order to improve that resolution. So since the basis of X-ray imaging is differences in densities of various tissues, it's important to know how different tissue or material types will appear on X-ray. And there's 5 important densities to know. 4 that arise from tissues and 1 from external implants, which we'll talk about here in a moment. So we're going to start up here with air, which is radiolucent. So this means that air appears black on X-ray studies. The best way to remember this is to think about X-rays as a black marker. Just like with a marker, air doesn't block the ink from reaching your paper, which means it will turn your paper black when it contacts the paper. But water, fat, bone, etc. certainly will block your marker from reaching your paper, or the X-rays reaching the detector in this case, but to different degrees, right? And so this leads us to the opposite end of the spectrum down here, where we're looking at metal, which X-rays cannot penetrate metal. In other words, metal is radiopaque. So when you see the term radiopaque, that means that the X-ray cannot pass through that material, at least not in large quantities. And so as a result, that means that your paper or the detector is going to remain white. So metal is going to appear white on X-ray. And similar to metal, few X-rays are going to penetrate all the way through bone or calcium deposits like kidney stones. And so that means that these types of structures like bone will appear almost white on X-ray. So they're not quite as white as what metal will appear, but they are going to have a whitish appearance to them. Now, fluid like blood or soft tissues like muscle are going to appear grayish on X-ray. Fat, which you will remember from chemistry, is less dense than water, since oil floats on water, and so that'll appear slightly darker gray than fluid or soft tissue on X-ray. So these are our 5 basic densities of conventional radiography. Air, which is black, fat, which is dark gray, fluid and soft tissue, which is light gray, bone, which is almost white, and metal, which is white. One caveat with the scheme, though, is that digital imaging, as we use now in modern day, allows us to subtract unwanted structures, and often this process will change the appearance of structures. Like contrast-enhanced blood vessels will appear dark instead of white after subtracting out unwanted structures. But that usually doesn't get in the way of being able to interpret what you're looking at. It's just important then to understand that can occur. So now looking at a couple of examples, on the image on your left, you can appreciate the whitest appearance of the bone. So again, you can see the ribs all appearing whitish. You can see the various parts of the shoulder joint, clavicle coming across. You can see the spine right here in the midline. So all of the bones are appearing relatively whitish, whereas the black, you can see the air located outside the person's body is appearing black, and then the lungs also have a relatively dark or blackish appearance on X-ray, because again, air is radiolucent, so the X-ray can easily pass through air without much trouble. And then the rest of the soft tissue, so like you can see the heart right here, you'll notice are going to have sort of this grayish appearance. So on the image on the right here, you can see an example of a hip replacement in the patient's left hip. So these replacements are made out of various metals, usually titanium, which is why the replacement in this case appears white on X-ray, because you're imaging a metal. So you can even see the screws. So these things sticking up right here are the screws of the acetabular cup. So the screws are holding the cup in the acetabulum of this patient. Now again, on this lateral view, you can once again appreciate the various densities of the tissue. Again, so this is just another chest X-ray looking from a lateral view. Now we're going to talk about fluoroscopy for a minute. So I mentioned before that contrast agents can be used to increase contrast resolution. And these agents will appear white on X-ray, similar to bone, or kind of like metal. And the most commonly used contrast agents are iodine for intravascular, intraventricular, intravesical, so that's inside the bladder, or other parts of the urinary system, and interarticular contrast. And then barium is oftentimes used for GI viscera contrast. So note that contrast agents, though, can elicit severe reactions in some patients. So although these agents are commonly used, they aren't 100% benign. In some cases, they can cause pretty significant issues. So we're going to watch a couple of videos here real quick just to get a better appreciation of what's known as fluoroscopy. So this is a person drinking a barium contrast agent. So we call this a barium swallow. And so you'll notice that effectively you're looking at an x-ray of this person. It's a live x-ray of the person drinking this barium agent. And so you might notice that that you might be thinking that, typically when we think of x-rays, you're just looking at an image, but in this case you're looking at a video. But this is not CT. So a lot of you probably know that CT and x-ray are very similar to each other, but instead this is something that we call fluoroscopy, or simply fluoro. So you can really see the value of fluoro, especially in monitoring procedures in real time, because it effectively gives you a video so you can see exactly where things are going in the body, right? And so I'm going to show you another one here, in which case we're going to be looking at an intra-arterial injection. So this is an example of cerebral angiography. So let me bring this back to the beginning. Okay, so again, you can see how the contrast agent was injected into the common carotid artery, and then it went up into the cerebral vasculature, into the arteries, and then now you're seeing it moving into the venous side of the circulation. So I think it's really easy to see why fluoro is widely used in the operating room to confirm the placement of medical devices, tubes, lines, etc. The main downside of fluoro, though, is that it exposes the patient and the healthcare workers in the room to very large doses of radiation. So just like X-ray exposes patients to a fair amount of radiation, there's much more radiation coming about from fluoroscopy. So let's go back to our PowerPoint here. So positioning is the last thing that I want to note about on X-rays here. And so the direction that the X-rays are passing through the body is very important, because this will impact the magnification, organ position, and blood flow. So as an example, with a posterior anterior X-ray, or a PA X-ray, this is obtained by projecting the X-ray beam through the patient from the posterior side of the body to the anterior side, with a detector being placed on the anterior surface of the body. On the other hand, with AP, or anterior posterior X-rays, in this case the beam is projected through the anterior and exits the body through the posterior surface of the body, with a detector located on the posterior surface of the body. And you'll notice when you look at the X-ray beam that it has this conical shape to it. It's sort of a cone. And so as a result, you have to keep in mind that the earlier that the beam comes into contact with the structure, the more that structure is going to be magnified. So on an AP view of the chest, for example, the heart is going to appear larger than it will on a PA view. And the PA view is the standard that we use for chest X-ray. So we'll get more into that in module 2, in the next module. But again, this is just important to keep in mind that the way that a patient is positioned is going to impact the way that it appears on the final image that you're looking at. So you always want to pay attention to, am I looking at an AP or a PA view? Now, again, the anatomy is obviously the same, but the way that things are going to appear are going to be slightly different depending on the positioning of the patient.